basic level, and you can advance to the higher level. So you can use this code, Dr. Divya 20 for first free live class, and you can make use of the features. And we have few subscription plans here. So basic, standard, and mentorship. And mentorship is a wholesome program where we give you at a discounted rate of 50,000 K, and where we offer you free the services like pre-recorded classes. Then there is live class, and even in the live class you can clear your doubts also. So, and one-to-one personalized guidance we offer to you. We give you the notes, so you have full access to all the notes. So you can see those things are not there in the other two plans. And there is also we offer quick revision in the examination module. So you can use the code DRDIVYA 20 for discount on this subscription. And so you do not have to wait for long. So you can book a slot for personalized counseling session using the code as seen on the screen. And about these internal exam marathon classes, which have started from April 22nd. So it goes on for about 45 days duration. So we are just focusing here on basically revising all the important questions rapidly, as well as certain facts like, which are very volatile. We offer quick revision here, and multiple choice questions also will be covered according to the CBME pattern. And here, with all these things, I'm sure you will get top-notch grades in your exam. So this is beneficial for the university exams of all the states. So with this, we'll start with today's series, second series. So here today's objectives are the long and short essays, which include the triangles, all the important triangles, that is the carotid triangle, the digastric triangle, the posterior triangle. We also will have a note on carotid sheath and ansa cervicalis. Then the hyoglossus muscle and its relations, thyroid gland, and short answers will focus on the digastric muscles and the carotid artery branches, that is external carotid artery branches. Right, so we'll begin with the first question, that is the carotid triangle. Now, we know the neck region has got triangles. So there is an anterior triangle here on either side of the midline. Then we have the posterior triangle on the side of the neck, and posteriorly there is a what we call as occipital triangle. So carotid triangle is one of the triangles in the anterior triangle. So this anterior triangle is further divided by these digastric muscles and omohyoid muscle, that is the superior belly of omohyoid. Here we can see. This is the superior belly of omohyoid. So this divides this triangle into 3.5 triangles on each side. So half of mental triangle. Then we have the digastric here, the carotid here, and the muscular triangle here. Okay, so these are the triangles we see. So we'll focus on carotid triangle. So one of the important triangles there. So when we just take this part of the triangle, this is the carotid triangle. Okay, right. So any triangle, we need to answer under the following headings. One is the boundaries, the contents, and the applied anatomy. So under boundaries, so what do we say under boundaries? So under boundaries, we have like here in the carotid triangle, okay? So we have a anterior-superior border boundary and anterior-inferior, okay? And a posterior boundary. So if you see here, the anterior-superior is formed by the posterior belly of digastric, okay, and anterior-inferiorly, it is formed by the superior belly of omohyoid, and posteriorly, it is formed by the anterior border of the sternocleidomastoid muscle. So these are the boundaries. So boundaries also includes the floor and the roof. Okay, so you need to talk about the floor and the roof too. So when we say floor, so floor here you will see two muscles, the middle constrictor of the pharynx and the inferior constrictor of the pharynx, a little portion of hyoglossus as well as the superior belly of, the thyroid. Okay, so you will see these four muscles in the floor. Right. So the roof, when we go from outside to inside, what do we see? We see the skin, then we see the superficial fascia, Then we have the deep fascia, that is the cervical fascia of the neck. Okay. And we will see, and in the superficial structures, okay, we can also see. So beneath that deep fascia, then we enter the contents of the triangle. Okay. Yeah. So in the superficially, that is in the roof, you may see some of the superficial nerves are also seen there. Okay. And then once we remove the deep fascia, we go to the contents of the triangle. So what are the contents? So when you have to draw, so usually when you answer this question, boundaries, you need to talk about the boundaries, that is anterior-superior, anterior-inferior, as well as the posterior boundaries, the floor and the roof. Okay, so you can draw a diagram and you can mention it, what structures are forming. Then contents, when we say, contents are what is present there. So here the important contents or the main contents are the common carotid artery and its branches, the internal jugular vein, and the vagus nerve. These three structures are present within the carotid sheath in the carotid triangle. Okay. So these are the three most important structures. In addition to that, we also will see the hypoglossal nerve. Okay. And on the, that is the anterior wall of the carotid sheath, we will see a loop of nerve. Okay. This is known as the ansa cervicalis. So this is seen on the carotid sheath. Okay. So these are the contents, right? So can anybody tell me what are the contents here? Divya or Jayendra, can you unmute yourself and tell me the contents? Okay, because this individually it can come as a short question. Okay, so yes, Jayendra, can you tell me? Okay, so when we say the contents, you should say this is the carotid sheath enclosing the common carotid artery with its branches, the vagus nerve, the internal jugular vein. Okay, and the hypoglossal nerve. And over the carotid sheath, we will see the ansa cervicalis. So those are the contents there. Okay, so you need to, for the contents also, you need to draw a diagram and you have to mention. Okay. And here, basically, a note, if it is a short essay question or a long essay question, you need to add a note about applied aspect. So what will be the applied aspect here? Okay, so here, basically, the internal jugular, to mention the JDP, that is the jugular venous pressure, we use this vein, okay? And then we also, here there is the carotid body. So where this carotid artery bifurcates, okay, we have the external and the internal carotid artery, where it bifurcates this common carotid artery. We have two structures there, carotid body and the carotid sinus. So the carotid sinus acts as a baroreceptor and the carotid body acts as a chemoreceptor. Okay, so this you need to mention about it. Right. Okay, so whenever we talk about a triangle, so what are the things? Can anybody tell me here? What are the things you need to talk about in a triangle? So whenever we discuss a triangle, it should be under what headings? So always when you remember the headings, it is always easier. Okay. So any triangle you need to talk about. You can unmute and tell me. Anybody? Yes. So you will talk first about, okay. So where it is located, I told you it is in the anterior part of the neck, okay, and forms a part of the anterior triangle. Then you will talk about the boundaries, okay. So next will be the boundaries, and third will be the contents, okay. So contents, and fourth will be the applied aspect. So how easy you can remember is always it's a triangle. So triangle will have three sides. So you will talk about the three borders. Okay. Then you will talk about the floor and talk about the roof. Okay. And when we talk about the contents here, what contents will we talk about? Contents, so easily you can mention this. One is, okay, if there are any nerves there, if there are any arteries there, so in that way you can remember, okay? And then there is any veins there, okay? In addition to this, in some triangles, there will be lymph nodes, lymph nodes can be present. Okay, like that. So nerves, here basically we had the vagus nerve and we had the hypoglossal nerve. Artery, mainly we had the common carotid artery and its branches. Vein, we had the internal jugular vein. In addition to these two nerves, we also had the ansa cervicalis. Okay, so these are the contents, and we'll write about the applied aspect as I mentioned. Okay, so this is the summary under what you need to explain the carotid triangle. Okay, so keeping this in mind, we move on to the next one, that is the digastric triangle. Okay, so here also we follow the same order of boundaries, contents, applied anatomy. Okay, and the location. So when we say location, so location again, where it is a part of the, yes, Kavya, can you tell me? It is a part of which triangle? Mainly, it's a part of the anterior triangle. You can feel free and, you can talk, you can interact. Okay, so it will be easier for you. You don't have to be a little apprehensive about talking here. Okay, so you can connect and talk. So here when we talk about again boundaries. Okay, so when we say boundaries, so which are the boundaries here of the digastric triangle? So digastric we are seeing up here. This is the digastric triangle. Okay, so digastric triangle is basically bounded. Okay, when we see the boundaries here. So digastric triangle is bounded here. So you can see anteriorly. Okay, so this will be anteriorly and inferiorly. Okay, because it comes in the inferior part. Anterior, inferiorly, it is the anterior belly of digastric. Posteriorly, okay, posteriorly and inferiorly, it is the posterior belly of digastric along with the stylohyoid muscle. Okay, and the base is formed by the base of the mandible and a line extending. So if you can see, there is a gap. Okay, from here to here. So here, what do? We draw an imaginary line. Okay, we draw an imaginary line from this portion, from the base of the mandible, that is from the angle, okay, of the mandible up to the mastoid process. So that encloses the digastric triangle. Okay, so this is the point. That is from the angle to the mastoid process. So this is the boundary of the digastric triangle. So coming to the contents. So contents here, we have anterior contents and the posterior contents. The posterior contents form the deep part contents. Anterior will be little superficial. Okay. So here, I told you, when we talk about the boundaries, we need to talk. It's a triangle. So we say the apex, base, the anterior, posterior, or superior, inferior, like that, roof, floor. So those will be the headings under which we will talk. So here we spoke about the boundaries, that is anterior, inferior, posterior, inferior. Base, we said the base of the mandible, an imaginary line drawn from the angle of the mandible to the mastoid process. Okay. Apex will be where these anterior and posterior boundaries meet. That is at the intermediate tendon. Okay. And floor here, if you see the floor, it is formed by three muscles: mylohyoid, hyoglossus, and middle constrictor of the pharynx. Okay. And the roof, when we say from outside to inside, it is the skin, the superficial fascia, and the deep fascia. Okay. As well as here, also in the superficial fascia, you will see the platysma muscle. The platysma muscle is a subcutaneous muscle. So it comes and gets attached to the base of the mandible here. So you'll be seeing it in this region. So contents now. Contents, I told you, there are superficial contents anterior and deeper contents posterior. So superficial contents here anteriorly, the main content is the submandibular gland. Okay, so we are seeing the submandibular gland here. So this is the main content. So superficial to the gland will be the facial vein which will be running there, and deep to the gland will be the facial artery. So facial artery will run deep to it, then it will come and wind to the base of the mandible and comes to the face. Okay. So that is why deeper to the submandibular gland will be the facial artery, and superficial to it will be the facial vein. Okay. And submandibular lymph nodes. Another important content what we see is the submandibular lymph nodes. Okay. Then, what else will you see? the deeper contents. Okay, the deeper contents when we come to, the deeper contents will be the external and internal carotid artery. Okay, so you can see this is the external carotid artery, and few of which branches you will see, that is the facial artery you are seeing here. And this is the internal carotid artery, okay, which will enter here through and goes to the through the carotid canal, and it enters the cranial cavity. So you see the external jugular, external carotid and internal carotid arteries. Okay, and you will see here, because here the parotid gland comes, a deep part of the parotid gland is also seen there. And attached to the styloid process, we see two muscles here. One is the styloglossus muscle going towards the tongue. Another one is the stylopharyngeus muscle, which is coming from the medial surface of the styloid process, and it goes to the pharynx. Okay. And between these two branches, we will see two nerves passing here. Okay. That will be the, so when the stylopharyngeus is running, we have the nerve of it, and the nerve supplying the stylopharyngeus is glossopharyngeal nerve. So it runs along there, okay? And there is the pharyngeal branch of the vagus nerve. So these two nerves we will see in the posterior part and the deeper part. So you can just draw a simple schematic diagram and mention the contents. Then clinical correlation. So the commonest here is the swelling of the submandibular gland, as well as the swelling of the submandibular group of lymph nodes. Okay, so any infection in this area or kind of malignancy in the area, it spreads to these lymph nodes and they are swollen. Okay, so this is what we see. So it is very common. And sometimes it can form a fistula and it can drain also. If it becomes an abscess there, submandibular abscess, it will form a fistula and drain outside. Okay, these are the things which you should know. Okay, so when we talk about just a recap, okay, so when we speak about it, okay, so digastric triangle. So what do we say about digastric triangle? Okay, so what are the things you will location? Okay, then you will talk about the boundaries, then you will say about its contents and applied aspects. Okay, contents and applied aspects you will talk about. So location, you will say it is a part of the anterior triangle present below the mandible, base of the mandible. Okay, so that will be the location. So boundaries, what will be the boundaries? There is anterior inferior boundary, antero-inferior, okay, which is formed by the anterior belly of digastric, posterior-inferior boundary, which is formed by the posterior belly of digastric, okay, and then and the stylohyoid muscle. Then we have that is the base, which is formed by the, there are superiorly base or superiorly, it is formed by the mandible as well as an imaginary line, okay, imaginary line, which is drawn from where? From the angle of the mandible up to the mastoid process, draw a line. So that is the thing we see, okay. And what else do we see? Apex. Apex is formed by the, where the anterior-inferior and posterior-inferior boundaries meet. So where is that point? That is at the intermediate tendon. So contents, when you talk about contents, you will talk about two things. One is the what is the superficial contents or the anterior contents, which are present, and posterior contents which are deep, okay, which are deep. Okay, and then you write about the applied aspects. Right, so next we move on to the carotid sheath. So carotid sheath here, when you see, okay, so it is a facial sheath because it is derived from the cervical fascia, okay. So the cervical fascia, no, that is the investing layer of the cervical fascia, it splits to enclose this structures in the carotid triangle, okay. So here you can see it is formed by the pretracheal and the prevertebral layers, okay, anteriorly by the pretracheal, posteriorly by the prevertebral layers of the cervical fascia. So it encloses which structures? The carotid artery and its branches, the vagus nerve, as well as the internal jugular vein. So these are the structures it will enclose, okay. So What is the purpose of it? Why does it enclose? Okay, so it encloses basically this neurovascular bundle to protect it. Okay, it provides. Here you have to remember that this carotid sheath, no, it is tight around this nerve and the artery, but a little loosely arranged around the vein. Okay, and why do you think it is like that? Kavya, can you tell me why do you think it is like that? Why do you think the carotid sheath is loosely arranged around the vein and artery, it is tight? Why do you think so? It is mainly because it allows for the expansion of the internal jugular vein. Okay, so when it is loosely arranged, because it is draining the blood from the cranial cavity. Okay, so it will allow for the expansion of the vein. So this is your sectional diagram where you can show. So how it is arranged there? Carotid artery is towards medial. Laterally, there is internal carotid artery, and posteriorly, there will be the vagus nerve. So that is how it is arranged. Okay. And then if you see on its wall, so on the anterior wall, we will see the formation of ansa cervicalis. These are the two roots of the ansa cervicalis. Okay, posteriorly, it is related to the sympathetic chain, okay, and the prevertebral fascia. So this is how you will answer. Okay, so carotid sheath, you need to know what is that first. What is the definition of carotid sheath? Okay, so carotid sheath, when we say, what do you mean by that? Okay, the definition of it. So definition is, it is a facial sheath, you will say, enclosing the neurovascular structures in the carotid triangle. Next, what will you talk about? The formation. So how it is formed. So formation is, it has an anterior wall and a posterior wall. So anterior wall is formed by what? Posterior wall is formed by which structure you will see? So anterior pretracheal prevertebral layer of investing layer of deep cervical fascia it forms. And then what do we have? After formation, what do we have to talk about? The contents, what it has. Okay, so you can draw a sectional diagram and show what are the contents present and what is the arrangement of the contents within the carotid sheath. That means which is medial, which is lateral, and which is posterior. Okay, as well as you can also mention about the presence formation of ansa cervicalis on its anterior wall. Okay, right. So next we move on to the next question, that is the ansa cervicalis. What do we mean by ansa cervicalis? Okay, so ansa cervicalis, when we say it is the loop, okay, U-shaped nerve loop. Okay, so you can see here, this is the ansa. Okay, it is a U-shaped nerve loop which is seen in the carotid triangle over the anterior wall of the carotid sheath. So it is embedded within the anterior wall of the carotid sheath. So where it is derived from? Okay, so if you see, it is derived from this ventral rami of C1, C2, and C3. Okay, so the C1, the ventral rami, okay, it will go along with the hypoglossal nerve, and then it will give a this thing, one branch. Okay, this is known as the superior root. Since it is running along with the hypoglossal nerve and then giving a branch, it is known as the what is the descendants hypoglossa, because it is descending down and coming from through the hypoglossal nerve. It is known as descendants hypoglossae. Okay, so we will see here. Okay, so where it is located, I told you. Next will be the formation. I'm telling you. So it is formed by this ventral rami of C1, C2, C3. Okay, and C1 passes along with the hypoglossal nerve, gives her the upper root, which is called as the descendants hypoglossae. And C2 and C3 join to form the lower root. And on the anterior wall of the carotid sheath, both these roots will join to form a loop. And this loop is known as ansa cervicalis. Okay. Ansa means the loop. Okay, since it is present in the cervical region, that is the cervical region means the neck region. Since it is present there, we call it as ansa cervicalis. Now, what is the next thing you need to know? Why it is forming a loop? It is basically forming a loop to supply the infrahyoid muscles. Can you name some infrahyoid muscles? Which are the infrahyoid muscles? Infrahyoid means coming from down and getting inserted to the hyoid bone. Okay, so which are those infrahyoid muscles? We have the omohyoid muscle, sternohyoid muscle, sternothyroid muscle, as well as thyrohyoid muscle. Okay. Here, except for the thyrohyoid muscle, it supplies the rest of the muscles. That is, this loop supplies the inferior belly of omohyoid. It supplies the sternohyoid, as well as it will supply the sternothyroid. Okay. So like this, it supplies the three muscles through this loop. The superior belly is supplied by the upper root, and the thyrohyoid is supplied by the branch through the hypoglossal nerve. Okay, so like that, this is what it supplies. So you have to draw this one simple diagram and you can write. Okay, so it is a very commonly asked question and you need to know. Even during your discussion in during the practical, it is very commonly asked during carotid triangle discussion. Okay, so ansa cervicalis. So again, just a quick revision, ansa cervicalis. So what are you going to write? Ansa cervicalis. First thing is, what do you mean by that? What is the definition of it? Okay, where it is located. Okay, so always for any question, you know, these headings, you always note it down at the side. Okay, you can make a sticky note and stick it on the side, or you can just make a note, or you can keep a notebook, draw the diagrams, write the headings and keep. So whenever you are revising, you can look through the diagram and you can see the headings and try to recollect. Okay, what is the definition? So it is a U-shaped loop. Okay, seen in the carotid triangle on the embedded in the anterior wall of the carotid sheath. That gives both the definition as well as the location. Okay, so why it is formed? So before that, you will write its formation. Okay, how it is formed. So you will, it has an upper root, which, what is that upper root? It has a lower root. So basically it is formed by the ventral rami of C1, C2, C3. So how the ventral rami of C1 comes through the hypoglossal nerve, and inferior root, how it comes from C2, C3. Okay, so you will write that. Okay, so, and how it forms a loop. Okay, so C2, C3 will form a loop, whereas C1 will join the hypoglossal nerve. So, and it supplies the three muscles. Okay, which one? Excuse me. So, it will supply the omohyoid muscle, that is the inferior belly of omohyoid. Okay, omohyoids. And it will supply the sternohyoid and sternothyroid. Okay, sternothyroid. So these muscles it supplies. So that is its function. Okay. Next, we move on to the next question, that is the posterior triangle. Okay, so posterior triangle, when we say, again, same thing, triangle. You need to know the boundaries, the contents, and the applied aspects. Okay, so boundaries here. Okay, so we have an apex, we have a base, we have the anterior boundary. So anterior boundary is formed by the posterior belly of the sternocleidomastoid muscle. Okay, and posteriorly it is formed by the anterior border of the, which one's? Trapezius muscle. This is the trapezius muscle. This is the sternocleidomastoid muscle. Okay, base is formed by the middle 1/3 of the clavicle. So middle part of the clavicle will form the base. Apex is formed where this anterior belly and posterior belly will meet. That is at the mastoid process. Okay. The floor is formed by, from about downwards when we go, semispinalis capitis, splenius capitis, levator scapular, scalenus posterior, as well as this one's scalenus posterior, scalenus medius. Small portion of scalenus anterior, but scalenus posterior and medius you will see here. Okay. Right. And this, the roof is formed here by, we have the skin, superficial fascia, the deep fascia. Okay. And superficially, you'll also see the nerves, that is transverse cervical, supraclavicular nerves. You can see great auricular nerve also. You are, we will see it in this region. Okay. So next, coming to the subdivisions here, this triangle is divided. Okay. Like how anterior triangle is divided, same way this is also divided. It is divided by the inferior belly of digastric into a smaller subclavian triangle and a larger occipital triangle. Okay, so what is this? Why is it called subclavian triangle? This subclavian triangle is otherwise called as supraclavicular triangle. And here it is supraclavicular because it is above this clavicle, subclavian because the subclavian vessels are there. Okay, and this is called as the occipital triangle. After that, you will have to talk about the contents. Okay, so subclavian triangle here. Okay, so subclavian triangle, the boundaries here, if you see, it will be the same. That is the what is that? Anteriorly, the sternocleidomastoid. This is the clavicular head of the sternocleidomastoid you're seeing. Posteriorly, it will be the trapezius muscle. Okay, and superiorly here, okay, small portion of trapezius, but superiorly here, it will be having the inferior belly of digastric because that is the muscle which will be superiorly, posterior superiorly, we have the inferior belly. And base is formed by the clavicle, okay? So those will be the boundaries. The roof floor here, roof will be the same thing, but floor here, we will have the scalenus medius and a small portion of scalenus anterior here, okay? And this side, a little bit of serratus anterior, you can see. So contents here. So contents mainly will be the subclavian artery. And in subclavian artery, it is the third part of subclavian artery, okay? So this scalenus anterior muscle divides the subclavian artery into three parts. So it is here. So second part is behind that anterior muscle, whereas the third part is this part, okay? So this third part we see there. We see the internal, subclavian vein, okay? Subclavian artery, subclavian vein. And to this subclavian vein, this external jugular vein will be open. So this external jugular vein also forms a part of the roof because it is little superficial. Okay. So you can see this transverse cervical here, the great auricular nerve here. Okay. This great auricular nerve, this is the transverse cervical nerve. Okay. This supraclavicular nerve, they all form the part of the roof. Next, in the occipital triangle, what are the contents? Near the apex of the triangle, we have the occipital artery going up. And here, there is an easy way of identifying, okay? So even in the specimen, how you can identify is, in the occipital triangle, at the middle of that, okay, that is of the sternocleidomastoid muscle here, you will see one nerve passing down, a little thicker nerve compared to others, piercing through the sternocleidomastoid and going towards the trapezius. That will be the spinal accessory nerve. Okay, so that is the point. So all the other nerves are emerging at that point and going up or down or across. Okay, so the nerve which will go along the posterior border of the sternocleidomastoid will be the lesser occipital nerve, which will go over the sternocleidomastoid muscle towards the angle of the mandible will be the great auricular nerve. And one which goes across the sternocleidomastoid muscle will be the transverse cervical nerve. Okay, so that is how you can identify them. And below that will be the supraclavicular nerves will be coming, okay, will be going downwards. And here you can also see other nerves, smaller nerves, that is third and fourth cervical nerves, okay. The next group of nerves, you see it in this subclavian triangle only, that is the upper and middle trunk of brachial plexus, okay. So the trunks are formed in the neck, the roots and trunks, we see it in the neck, okay, and of the brachial plexus. Okay, and the divisions and this thing, the divisions, we see it behind this clavicle, and the cords, we see it in the axilla. So trunks of this upper and middle trunks, you can see it here. Okay, so this is how it will be, what are the contents. Now this thing is very important here, okay, because here, no, this portion of the triangle, that is the superior part of the triangle above the point where all these nerves emerge, is known as the safe part of the triangle. Below this is known as the unsafe part. Now, why it is called safe part? Can anybody say? Why is it called safe part? It is called safe part because this portion, here you don't see any nerves because this nerve will be running along the border. So if you see as such in the triangle, there are no nerves. Okay, but in the below part, Here there are so many nerves. Okay, so why this is important clinically is what happens is if there is an abscess here, okay, some abscess or something when we need to do a surgery here or open up here, make an incision, we will go above, we will not go below because here we can injure these nerves. Okay, and most commonly injured nerve will be spinal accessory there, and if spinal accessory is injured, both the muscles, that is the sternocleidomastoid and the trapezius, are paralyzed. Okay, right. So I'm not the team. Actually, I'm not able to change the slide. Is there any problem here? Okay. Right. So this is how we will summarize. Okay. When you write. So always know the headings and how which you have to describe the answer. So when you know the headings, the presentation of the answer improves and you can present it accordingly. Okay. So we move on to the next question, that is the hyoglossus and its relations. Okay. So So hyoglossus muscle. Okay, so hyoglossus muscle, it is, as the name says, hyoglossus. So hyoglossus means from where it is coming, the origin is from the hyoid bone. And where will it be getting inserted? It gets inserted into the tongue. Okay, so it is coming from the upper surface of the greater cornu and adjacent part of the, that is, this is the greater cornu of the hyoid bone and adjacent part of the body of the hyoid bone. It originates. And where does it get inserted? It gets inserted into the posterior half of the tongue. Okay, so here this is the posterior half of the tongue on the sides. No, it gets inserted. Okay, so here the relations are commonly asked. Okay, so it's basically like if you see the shape of the muscle, it is a quadrilateral muscle. So why this muscle relations is asked is because this muscle, it forms a key muscle, okay, key muscle of the suprahyoid region, okay, because many structures are in relation to that, either superficial to that or either deep to that. Now, if you see here, the superficial structures, okay, what are we seeing? Superficial structures. Okay, so if we go from above, so first we have the lingual nerve. Okay, so lingual nerve will cross across here, okay, from the muscle. From behind, it crosses forwards where it will go to the tongue to supply the tongue. Okay. Then we have the hypoglossal nerve down. Okay, this is the hypoglossal nerve. So hypoglossal nerve also covers. So if lingual nerve is going in the upper part, hypoglossal nerve is going in the lower part. Okay. Then we have the deep part of the submandibular. Submandibular, this gland, this portion what we are seeing is the deep part of the submandibular gland. Okay, then we will also see the submandibular ganglion here. Okay, that is another thing. And then we see the styloglossus. This is the styloglossus muscle and a small portion of mylohyoid muscle we will see. Okay, so this is genoglossus. So mylohyoid here in the picture it is not there, but the mylohyoid muscle will be overlapping. Okay, here in this portion it will be overlapping this. What is that? Hyoglossus muscle. Okay, so you will be seeing here. So these are the main structures. So you should not forget these things. That is the lingual nerve, the hypoglossal nerve. Then we have the deep part of the submandibular ganglion, the deep part of the submandibular gland, submandibular ganglion. Okay. Then we have the styloglossus muscle. Okay. This is the submandibular duct. Okay. You can see here. It is opening at the base of that is the ventral portion of the tongue here. Okay. So these are the things you will see. And here in relation to this nerve, no, that is hypoglossal nerve, you will see a pair of venae committents. Okay. Venae committents means when two nerves are running together. Sorry, not two nerves, two veins are running together. Okay, accompanying an artery. Usually it will be accompanying an artery, or sometimes maybe a nerve here. Okay, so they are known as venae committents. So deep structures. So structures which we are seeing deep here. Okay, one will be the inferior, that is down here, will be the inferior longitudinal muscle of the tongue is there. Then genioglossus muscle. This is the genioglossus muscle we see. Middle constrictor of pharynx. Okay. So behind this hyoglossus, we will see the middle constrictor of pharynx also. And here you can see which are coming from back, glossopharyngeal nerve. Okay. Then stylohyoid ligament. This one from the styloid process, this green thing, stylohyoid ligament is there. And we see the lingual artery. So these structures forms the what is that? The deeper structures. Okay, so this is the thing which you need to know. So this muscle, basically hyoglossus muscle, since it is develops from the occipital myotomes. Okay, and occipital myotomes, they form part of the muscles of the tongue. Okay, isn't it? So muscles of the tongue are derived from that. So that is why it is supplied by the hypoglossal nerve. So what is this action of this hyoglossus muscle? Hyoglossus muscle, see, the muscle is getting inserted into the side of the tongue. So when the pull is always towards the insertion, it pulls towards the origin. So when it pulls down, what happens? The tongue is depressed downwards. Okay, the sides are depressed so that the tongue, what happens? The dorsal surface of the tongue, it becomes more convex. Okay, as well as it will also help in the retraction of the, when we put our tongue, when we protrude our tongue, like, like that, when we protrude the tongue, when we pull back the tongue, that will be the action of hyoglossus, to pull the tongue back. That is the retraction of the tongue. So these are the things which you should know for hyoglossus muscle. Okay, got it? Okay, so any muscle, always you have to remember. Okay, so any muscle, you need to know, you have to talk about its, where is the muscle of which region or any special features. Now here it is a quadrilateral muscle of the suprahyoid region and all you said, no? So that is what we need to write first. Okay, that is basically like an intro of the muscle. Then you write about the origin, you write about its insertion, then you go for, you have to talk about what. So it's just like where it is. If you just know the key points where the origin is, that is from the greater corner of the hyoid bone and adjacent part of the body, inserts into the side of the tongue. Okay, it will be more than enough. Okay, then nerve supply. Nerve supply, since it is derived from the occipital myotomes, it is supplied by the occipital nerve. Then the action. Okay, so action, when you know where, how it is inserted, where it is inserted, to remember the action, it is easier. Okay, and here, since this muscle is a key muscle of that region, we need to know the relations there. What structures? So whenever you remember relations and all, group them, like, which muscles are there or which nerves are there, which, so you remember in an order. So which are the nerves, which are the muscles there, which any gland there or which lymph nodes are there. Okay, which arteries there. So that way it becomes easier to remember. Next is thyroid gland. So thyroid gland, again, what do you have to know about thyroid gland? So thyroid gland, it is a special gland. Why it is a very special gland? It is a endocrine gland, yes, but it has got some peculiar features. Okay, so it is a gland which is superficially located in the midline of the neck. Okay, then it requires an what is that? External source for the production of the hormones, isn't it? So it requires iodine for the production of hormones. And unlike other endocrine glands, this gland produces and stores the hormones. Okay, so that is important. So you will talk about the location, the coverings, presenting parts. So gland, you have to describe. Any gland, we need to describe under these headings: location, coverings, presenting parts, relations, blood supply, lymphatic drainage, and applied aspects. Okay. So when we talk about location, I already told you it is located in the midline in relation to the vertebral level C5 to T1. Okay, in relation to that across. Okay, so it is located there. So coverings. So coverings what? So it will have, usually all the glands will have two coverings, a true capsule and a false capsule. So true capsule is formed by the condensation of its own connective tissue, whereas the false capsule is derived from the, okay, this false capsule is derived from the cervical fascia. Okay. So what is important here is, if you see the venous plexus here, they are located deep to the gland, okay, deep to this true capsule. Okay. So whenever, so what we do is, when there is surgery of the thyroid gland, no, we remove it along with the capsule, because here, since it is present deep, if you think that it can cause heavy bleeding. Okay. Next, you should know the relations. Okay, so relations of the gland. So when we say the relations, you can see here. Okay, so which way the relations. So now, okay. Yeah. So before that, let me talk about the presenting parts also here itself. So presenting parts here, so the gland is having what? It has two lobes. It has an isthmus, okay? And it can have a small pyramidal lobe, okay? And attached to that, there will be one connective tissue, which will be connecting it to the hyoid bone, which is called as the levator glandulae thyroideae, okay? So because of that, no, usually what happens is it moves with the deglutition, okay? And each of these lateral lobes, no, it is roughly, if you see, it is pyramidal in shape. It has an apex, it has a base here, and it has three surfaces. The surface which we see here is the anterolateral surface. Towards the inside will be the medial surface, and behind this will be the posterolateral surface. Okay, so it has three, and it has two borders, that is the anterior border, okay, and a posterior border behind. Okay, so that is the thing. So here, if you see, this will be the anterolateral surface and posterolateral surface here, and this will be the medial surface this side. Okay, this will be the anterior border and posterior border here. So it is enclosed by this fascia. Yeah. Okay, now coming to its relations. So what are the relations here when we see? Okay, so anteriorly, no, it is related to these muscles. Which muscles are there? Sternohyoid, sternothyroid, omohyoid superior belly. So each of that anterolateral surface is related to these muscles. Okay, sternohyoid, sternothyroid, omohyoids, and that is superior belly of omohyoid and portion of sternocleidomastoid muscle. Posterolaterally here, if it is related to the carotid sheath and its contents. Okay. And behind here on the medial surface, in the center posteriorly, it will be related to, that is, or you can say the medial surface, it will be related to the trachea and to the esophagus. Okay. And there we also have the recurrent laryngeal nerve in relation there. Okay. And enclosed within this sheath, that is the facial sheath, we have the parathyroid gland. Okay, so these will be the relations of the thyroid gland. The blood supply. So blood supply is mainly, so it is by the superior thyroid artery. Now, superior thyroid artery is a branch of the external carotid artery. Okay, so superior. So it divides into anterior, posterior branches, and it will supply the corresponding surfaces. Okay. Then it is also supplied by the inferior thyroid artery. Inferior thyroid artery is coming from the thyrocervical trunk, of which is a branch of the subclavian artery. Okay. Sometimes one more artery will be there, which is coming from the subclavian directly, which we call it as the thyroidea artery. Okay. So basically these arteries are the main arteries which supply the thyroid gland. So you should know. Here what we have to remember is, in relation to the superior thyroid artery, we have the superior laryngeal nerve. So in the initial portion, the upper part, what happens? Both this nerve and the artery, they run together. But when it comes towards the thyroid gland, they will split apart. Okay. And so because of that, when we do a surgery, when we ligate the artery here, okay, in the superior part, we ligate it closer to the gland. Okay, because the nerve is away here. But in the inferior part, near the base, what happens is the recurrent laryngeal nerve is in close relation to the inferior. So here we ligate the artery away from the gland. Superiorly will I get towards the gland. Okay. And the venous drainage, always blood supply is not complete without talking about venous drainage. So you should talk about the venous drainage. We have the superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein. Okay. And along with that, there is one more vein, Koch's vein. Okay. It is called as Koch's vein. So these veins, they drain basically into the, that is superior and middle, and these Koch's, they drain into the internal jugular. Okay. Whereas this inferior thyroid, it drains directly into the subclavian, that is brachiocephalic, brachiocephalic vein. Okay. Then coming to the lymphatic drainage here. So lymphatic drainage is basically to the laryngeal group of lymph nodes, okay, and pretracheal group of lymph nodes. It also goes to the jugulo-digastric as well as to the jugulo-omohyoid group of lymph nodes from these. Okay, so laryngeal, pretracheal, then from pretracheal it goes to this jugulo-omohyoid group of lymph nodes, and above it can go to jugulo-digastric group of lymph nodes. Okay, so the swelling, okay, so enlargement of the thyroid gland, we call it as the goiter. So goiter means usually the enlargement. Okay, so it can be because of various causes. Okay, so goiter is the enlargement. Okay, so enlargement. So it can be because of anything. Any enlargement, we call it as the goiter. So, and hypothyroidism is where when the thyroid hormones are at a lower level, and hyperthyroidism. And common malignancy, thyroid malignancy is less malignant. It is not very aggressive malignancy. Okay, so it can be removed completely, and there is good prognosis. Okay, so this is how you describe the thyroid gland and the location, coverings, presenting parts, relations, blood supply, lymphatic drainage, and applied aspects. Next, coming to short answers. First is the digastric muscle. So digastric muscle, okay, we have the anterior belly and the posterior belly. Okay, so you talk about the origin, insertion, nerve supply, and action. So origin is digastric, that is the anterior belly is from the digastric fossa of the mandible, okay, and the posterior belly comes from the mastoid notch of the temporal bone. Okay, this is the mastoid process. So mastoid notch of the temporal bone it comes, and both of them, the insert fusure forms the intermediate tendon by which it is hooked to the hyoid bone. That is the greater corner of the hyoid bone it is hooked. Okay, so like that, these are the two, origin and insertion. Okay. So digastric muscle. Now digastric muscle, okay, it is derived from which brachial arch. So based on that, it is supplied by digastric muscle. First brachial arch it is derived. So first brachial arch, the nerve is the mandibular nerve. So the branch of mandibular nerve supplies the digastric, that is through its lingual. Okay. Right. So next we go to the second question, that is the carotid artery and its branches. So carotid artery and its branches here. So we have two common carotids. Okay. So you should be very careful, the right and the left. Okay. So here if you see, the right carotid artery is a branch of brachiocephalic trunk. Okay. Which is coming from the arch of aorta. Whereas the left common carotid artery is a direct branch of arch of aorta. Okay, and it at the level of the greater corner of the hyoid bone, thyroid bone. Okay, that is the superior horn of the thyroid bone. So thyroid cartilage. Sorry. Okay, there it will divide into two. That is the right common, that is external and internal carotid artery. Okay, right and left at that level. So here, basically, we need to know the branches of the external carotid artery. Okay. So external carotid artery now, it begins at the termination of the common carotid. So common carotid terminates at the level of the superior horn of the thyroid cartilage, just in front of the middle part of the sternocleidomastoid along the anterior border, okay, of the sternocleidomastoid. So here, when we remember and external carotid will begin there. That termination point will be its original point. Okay. And this, what is that? External carotid artery will terminate within the substance of the parotid gland, dividing into two terminal branches. That is the maxillary and the superficial temporal. Okay. Maxillary and the superficial temporal, it will divide. So you should know the branches. Okay. So here when we tell, so the branches. Okay. So how will you remember the branches of external carotid artery? So external carotid artery, when we talk about the branches, you should know the anterior branch. Okay. The posterior branch, the medial branch, okay, and terminal branch. Okay. So anterior branch will be the from what is that? From below upwards when we go, we have the superior thyroid artery. Okay, superior thyroid. Then we have the lingual and we have the facial. Posteriorly, we have the occipital and posterior auricular. Okay. Posterior auricular. Medial will be the ascending pharyngeal. Okay, ascending pharyngeal. And terminal will be the maxillary and maxillary branch as well as the superficial temporal branch. Superficial temporal branch. Okay, so this is what. So here I will show you. Okay, so this is the superior. These are the anterior branches. Superior, thyroid, lingual, facial. Okay, this is the medial branch. This is the ascending pharyngeal. Posterior branches are the posterior auricular and the occipital. Terminal branches are maxillary and the superficial temporal. Okay, transverse facial artery is a branch of the superficial temporal. So this is about today's class. So with this, we finish the class. Okay. So I would like you to also interact in the class. So you can, when I have asked the question, you can ask. So it will be good. Okay. So thank you for watching Auricle. And you can download the app on Google Play or App Store, as well as you can also follow the contents in the social media handles. So we are everywhere, like, you know, the YouTube, the Instagram, Facebook, or Telegram, right? Okay. Thank you.